In 2009, only 250 health facilities in Uganda provided pediatric HIV services. Few caregivers were aware that children and babies can get tested and treated for HIV. Limited capacity at health facility level to identify, treat, provide care for and counsel infected children and their caregivers was one of the major issues that needed to be addressed.
When we began to manage pediatric HIV, we realized we had a lot of gaps. We needed training manuals, we needed, and more importantly, we needed really good communication for children, because communicating to children is different.
In response to the situation, the Ministry of Health and its partners, with the support from the Health Communication Partnership and the Regional Centre for Quality Health Care, developed a national training curricula and job aids on paediatric HIV testing, care and treatment, and on paediatric HIV counselling.
We had a technical team that knew the technical content for paediatric HIV. And on the other side, we had a person who knew about adult education. So the two teams really worked together to make sure that the content fits the right target group. In the entire process of development, we involved the end user. So we would work together, develop curricula, and go and pre-test. The other key thing was that we developed job aids, and we made sure that the modules are tailored into helping the health workers to use these job aids.
Together with the Ministry of Health, the Health Communication Partnership trained trainers of trainers who then cascaded the trainings to other providers.
We have conducted a number of trainings after that orientation, TOT, and we have trained staff from over 11 facilities in this region. This training and the job aids that came with it, we are seeing children started on treatment in a time, and that is reflected in our numbers that we have for children who have started on ART on time. So that is really quality of care improvement.
By April 2012, about 1,500 health workers had been trained across the country in care, treatment and counselling for children with HIV and their caregivers.
What I do as a clinician is replicated by another clinician and replicated in the world, because there are guidelines here, the guidelines in the world. There's also our knowledge gap and issues to do with the dosing, what dose, for what age. That one also helped us because we came back with guidelines and we have protocols.
As a result of the care and treatment training, the number of sites offering paediatric HIV services has increased by over 100 facilities over the time that the curriculum was rolled out. Early trainees in the counselling curriculum are also seeing an impact.
We had just little knowledge, we could talk to them, but since we were trained now, we have our special room, we invite mothers with their children in, then we talk to them.
In addition to involving health workers in the development of job aids, children and adolescents living with HIV were involved in developing interpersonal communication tools that would be reflective of their situations.
We discuss a lot of things, especially that age group. Oh, it is so interesting because they ask you a lot of stuff, sex, relationship.
When I use a condom, do I get 100% protection?
But although the quality had been improved, utilization remained low because parents still didn't know about them. Therefore, facilities were labelled with a logo and an intensive community mobilization campaign was implemented.
I took my child for testing. You too can take yours. Visit your nearest health center for testing or look for a health facility with a signpost of the family and the yellow sun. HIV treatment is free for children. Be their key to life.
When we open the lines for our listeners to call in, you discover that they want to learn more. There is a lot of information that people do not know, and our people expect us to tell them this information.
And this is audio clip 7. How does a discordant couple really build a marriage and have healthy children?
As a result of the campaign, double the number of children were started on treatment than in a comparable time period. It is this combination of the multimedia communication campaign, the community mobilization activities, and the systematic strengthening of the health workers to counsel and treat children that is making a difference.
I want to call upon all our different partners to embrace pediatric HIV care and treatment, to make sure that the key tools that we have developed, the trainings, are used more and more, the different job aids are used more and more, the communication strategy that we've developed are used more and more, and this should be able to lead us to getting more of these children into care and making a difference in their lives.